CDC is set to roll out its guidelines today for reopening K through 12 schools. CBS News has obtained a draft of the agency's guidelines. The plan divides K through 12 schools into 4 color categories based on community transmission. Blue zones have low transmission and are open for full in-person. Yellow is moderate transmission but can also stay open. Orange means substantial transmission in schools should switch to hybrid learning and reduce attendance. And you guessed it, red means middle and high schools should switch to virtual learning if there's no regular testing. If testing is done, all schools should use a hybrid model. Dr. Bob Lahita is in Saddle River, New Jersey. He's a professor of medicine at the New York Medical College and the chairman of medicine at St. Joseph University Hospital. So, Dr. Bob, it strikes me that these color codes, it was always a bad idea to use color codes as if the American people were in the military. I never thought it worked well in the wake of 9/11, and now these color codes do kind of remind me of threat levels that you would experience in the military. But beyond the color codes, what do you make of the guidelines, and what do we know about the rates of community spread as it applies to each color-coded zone?
Well, Vlad, we've heard a long time from teachers that were very uncomfortable going back to school. And, you've heard of the strikes in various parts of the country, Chicago, for example, New York City, where there's been a reluctance to get back into the school. And despite the fact that we've said that little children, while they can be carriers, are generally not the ones who infect others. So this is a very good guide. I think, at least it's some sort of a guide. We knew that junior high school and high school students are to be treated like adults. They can get the virus, carry it, transmit it asymptomatically, and eventually get sick from the virus. But with little children, that is not the case. So now you go into various areas, such as in this area in New York City, the Bronx, where there's rapid transmission, especially among families who live in close quarters. So these color codes, like the red and the yellow, which are the high-coded areas indicating great transmission, are very logical. And people relate to colors. They understand, if they're in a red zone, that this is an area where virtual learning is probably a better idea than coming to school. Also good for the teachers, who have been very, very uncomfortable getting back to the classroom.
Yeah, so true. The CDC is now recommending double masking because research found that it can block nearly 93% of potential infectious particles. I have a two-part question. Is that something that you recommend for children? And also, if you have one of those N95 masks, is a single mask good enough? Because as I understood it, the 95 stood for 95% sort of blocking stuff out.
Yes, Anne-Marie. Well, those are both good questions. First of all, let me deal with the double mask with children. Children have a tough time keeping one mask on, much less 2 masks. It's really dependent on the age of the child. You know that trying to get a mask on a kid and trying to have them wear 2 masks is virtually impossible. So 1 mask, as far as I'm concerned, for a child would be okay. And when you're in the elementary and kindergarten classes, it's out. It's out for grabs, actually, because I don't know if a child that young will keep a mask on for more than 2 minutes. The other thing is the N95 mask is sufficient. People who wear N95 masks in healthcare and other areas are what we call fit tested. They have testing done to make sure that the masks fit their face, the size, so that no air escapes and you don't fog your glasses, for example, when you're wearing the mask, if you wear glasses. So N95, you're correct. It protects you against 95% of the infectious particles and you spreading it on. We use the N95s in the hospital routinely.
So there have been a lot of questions surrounding the safety of pregnant women getting the coronavirus vaccine. This week, Dr. Anthony Fauci said that 20,000 pregnant women have been vaccinated without complications. The CDC doesn't have any clear guidance on the matter and only suggests that pregnant women seek guidance from their doctors. So far, there's been no testing on the effects these vaccines could have in women who are pregnant. So what would you recommend somebody who is pregnant to do in this situation?
I recommend that all people who are pregnant get vaccinated. We have no evidence that the messenger RNA, especially that vaccine, has any effect on the placenta, on the fetus, on the mother. except if one gets the infection, the COVID, and you are pregnant, you run the risk of becoming very, very sick. And we've had some very unfortunate events happen in the metropolitan area with pregnant women. So I recommend highly that all pregnant women be immunized from initial discovery of the pregnancy right up to term.
A handful of U.S. doctors claim to have found a drug to help elderly patients fighting COVID-19. It's called Ivermectin. Now, this drug has not been approved by the FDA for use to fight COVID-19. They say more testing needs to be done. But what can you tell us about the drug?
This is an old drug, Anne-Marie. I've known about ivermectin for years. It was developed by Merck to overcome river blindness in Africa. And it has been used also to control parasites in sheep and cattle, and has been very, very, very useful as an anti-parasitic. It is not an antibiotic in the strict sense of the word. The Chinese used it early on for COVID-19. There is really no data to suggest that anything adverse can happen with this drug, and it may be, in fact, helpful. And it's one of those things that the CDC says, well, let's try it and see, but they're not against it, but they're not for it. There's no data in an organized clinical trial that tests ivermectin against COVID-19 infection. In our hands, in hospital patients, we did use it back in the spring and early summer and found it had no effect.
Okay, Dr. Bob, always a pleasure. It's always good. You know, when Dr. Bob's here, it's a Friday, so it's like a twofer. You know, you're getting good information and it's a Friday. Thank you so much, Dr. Bob Lahita.
Thank you, and thanks, Vlad.